Welcome to the Rules Advisory Committee. I'm going to say it in advance so I don't forget later. I'm incredibly grateful and humbled that such a great group of professionals would be willing to give up time to help us make sure that our rules that are mandated by the legislature are the very best that we can achieve. And that's done through collaboration and inclusivity. And I'm really, really grateful for you to be here today. So we can do a group introduction if that's cool. I'll go. Again, my name is Ann Thompson. I'm one of 2 policy analysts here at the Health Licensing Office. I oversee the work of 8 boards and 5 programs. And the Behavior Analysis Regulatory Board was my very first board going on 11 years ago. So I've been here since Genesis. So if we want to go around and quickly introduce ourselves, Dawn, would you like to tell us a little bit about yourself?
Sure thing. My name's Dawn Bailey. I'm a licensed behavior analyst here in Oregon, a BCBAD, and an associate professor at Oregon Institute of Technology, representing the rural areas here in Oregon.
Welcome. Thank you for being here. Jamie Pulliam.
Hi, everybody. Thanks for having me. I'm Jamie. I am an RBT here in Portland, Oregon.
Thank you so much for joining us. Jennifer White.
Hey, I'm Jenny.
Oh, could you speak up, Jennifer? I can barely hear you.
Oh, yeah, sorry.
I still can't hear you.
On just a second.
Okay, while she works that out, Nirvana, would you like to introduce yourself? Okay, we are not hearing from Nirvana. Michelle Sherbon.
Good morning, everyone. I'm Michelle. I'm a licensed behavior analyst, BCBA, here in Oregon, work primarily out of Tualatin, and I'm the clinical director of LifeStance Health. So thanks for having me here.
Thank goodness. Jennifer, I see your hand up. Are you back with us?
Hopefully, can you hear me better now?
Yes, yes.
Oh,
Thank you very
perfect.
much.
Awesome. I'm Jenny. I'm a BCBA here in Oregon. I am a BCBA that works in schools. I also teach at the Oregon Institute of Technology in their ABA program. I'm on the BARB, and I'm also the secretary for our state association, RABA.
Okay, fantastic. You know though that you're not here as a board member, right? You're here as a practitioner.
Yes.
Okay, very, very good. Okay, I don't see Elisa Nelson. Nirvana, can you hear us? I've been trying to reach out to you. Would you like to introduce yourself? I cannot hear Nirvana. Okay, Lisa, once Watson, now Taylor.
Hi, good morning. I am a licensed behavior analyst, BCBA here in Oregon. I'm just happy to be here.
Fantastic, and we're happy to have you. And Jessica Coimbra.
Hello, I'm Jess. I'm a small business owner. I have my own practice as a BCBA. I'm moving to Oregon this month from Seattle, and I'm also a member of the autistic community.
Fantastic. Well, thank you so very much. Good morning, Sam. You have joined us.
Hi, good morning. Yes.
Excellent. My name is Ann Thompson. We're in the middle of introductions, so you're up. Introduce yourself to the group.
Sam Garcia, BCBA, living here in Corvallis, Oregon. I'm clinical director at the Bright organization.
Fantastic. Well, we are welcome. We welcome you warmly, and we are having some bandwidth issues. So if you want to turn off your camera, that might help keep other people from getting kicked out. It seems that all of us are having tech issues this morning, so we are one in that issue. I'm really having trouble getting a hold of Nirvana. Can you hear me? Okay, she's not responding. I'm going to ask Carrie if you could reach out to Nirvana and see if she is available or needs to log off and log back on. Because this is not a voting body, we're just going to move forward. We are missing a couple of people. We are on a tight timeline. I tend to speak very quickly. Feel free to jump in, raise your hand, do whatever you can to stop me. I'm going to try to facilitate my part with the training as quickly as possible so that you guys have the maximum amount of luxurious time to discuss the issue before you today. Okay, so if we don't have any more questions, we are going to move into a little brief training on what racks are all about. Nathan, you have your hand up?
I do. Nirvana's mic is muted. Maybe she can hear you. She may not realize her mic is muted.
Yeah, I've seen that. I'm not sure if she
Okay.
knows to turn it.
I'll try and get a hold of her and see if we can figure that out.
And to the group, I am so blessed to have Nathan and Carrie here. They're my guardrails, and they keep me out of the ditches. So thanks to both of them. So if it's okay with everybody, I'm going to go ahead and share my screen. And you should be able to see a PowerPoint presentation come up with a green screen. Do you see it? It says Rules Advisory Committee Training. Somebody give me a thumbs up.
Not yet.
No.
I'm not seeing it.
No.
Okay. Here we go. Let's try it again.
There we
Do you see?
go.
I love you guys already. Thank you, Michelle. Oh, the thumbs. Thank you all so much. Okay, so welcome to the Rules Advisory Committee. I don't know if anybody have been on one of these before. So we've kind of done a broad overview of what you're going, kind of your zones of influence and what you're going to be doing today. So we convene RACs to when we're looking at rulemaking. Oregon values three things: inclusivity, transparency, and frugality. And rules have the weight of law. They put on the road, essentially, the legislature tells us to design a car, right? So I have come up with a draft, the car, and you guys are the test drivers. You are the guys that are going to look at it as practitioners, as recipients of services, and say, does this rule get us where we want to go based on legislative intent? Okay. I put out an invitation. We try to get as many different kinds of communities represented, not just ethnicities, not just, but geography. Again, the rural, the urban. Oregon is such a diverse place. Access to resources are different. Access to internet is different. I mean, even though we're right in the middle of where it's supposed to be good, we still struggle. So we want to make sure that rules work for everyone. And one of my mantras is that rules are the floor, not the ceiling, right? You can't go below what a rule says, or you could be cited, but you can always do more. You can always do better. And also, rules are not going to make anybody happy, any one stakeholder group, because we all have to compromise. Okay? So we have gathered folks that have interest in the rule, they're practitioners. You guys will make recommendations to me today, and I will provide the recommendations to the board at its July meeting, and they will decide whether to accept it, to tweak it, maybe go in a different direction. So your advisory capacity. Okay, one of the things that this is a public meeting, so it's been noticed. It will be posted on the internet. And also, I will need your help, and I'll bring this up again at the end. We have two components I'm really going to need from you today. One is a fiscal impact, and we're going to talk about the fiscal impact of the rule on the folks that have to obey the rule. Are they going to have to buy anything to comply? Are they going to have to hire staff, for any of the documentation? Have to think about that. And also, House Bill 2993 a couple of years ago created what's called the racial equity statement. All rulemaking has to address how this rule might close racial equity gaps, access to care, access, social justice issues. So we're going to talk about that kind of at the end. So just think about that. We have to get recommendations today. I've provided a draft for you to discuss. Once that draft goes to the board will adopt proposed rules, which will go out for public comment. Then we have a public comment period, a hearing where people can express their concerns or additions or subtractions. If they are minor, the board then adopts permanent rules. If there is a massive change, what we would consider a sea change in the rules, say a qualification was a bachelor's degree and now all of a sudden the board goes, we really want a master's degree. That is a massive change that could have a fiscal impact. Then we would have to go all the way back to the beginning of the rulemaking process. Nobody can change the rules of the game on the finish line. Okay, so that's kind of how it works. Just a really quick Civics 101. There's 3 branches of government. The legislature makes the law, and that's the bill that we're going to talk about today. We, as the Health Licensing Office of the Executive Branch, we carry out the law. If there's any question about interpretation of the law, what did it really mean? Then that is up to the judicial branch to figure that out. We're going to do a quick detour here. We talk about statutes. Statutes are laws that are enacted by the legislation. We are tasked with carrying those out. The only thing we can do as a member of the government is to do what they specifically give us permission to do. Even if it's a good idea, anybody who's served on a board knows they might want to do something, but if the legislature doesn't specifically allow you to do it, you can't do it because government agencies don't have the same power as individuals. Okay, statutes are essentially bills or laws. We're very specific here, so we say statutes. Those are bills that have been assigned a number, a 6-digit number. You'll see one of those today when they're codified and they become a statute. That is the foundation that we operate on. Again, we talked about we only have the power. I'm jumping through quickly because we don't have much training time. Again, agencies, boards are creatures of statute. Even if it's a good idea, if we don't have permission, we can't do it. Okay, you'll hear us say ORS versus OAR. ORS is Oregon Revised Statute. That's a law. It's a 6-digit, again, 676, 655. OAR is an Oregon Administrative Rule. What we are talking about today is a draft administrative rule. They both have the power of law, but they function a little bit differently. Usually rules will clarify. A law might say something like license underwater basket weavers. The rules then say how. How do you apply? What are the qualifications? Sometimes when laws are passed or statutes are passed, they're extremely specific. Sometimes they're less so. And sometimes they have what are called delegative terms. Exact terms are things like 18 years of age, 1 calendar year. That's easy to prove, hard to debate. Social Security number. Okay. Then you have inexact terms like wildlife. Somebody in Alaska is going to have a very different picture when you say wildlife than somebody in Florida. That's when a rule might help clarify what that inexact term says. And then there are delegative terms, which thankfully we don't have to deal with today. And that is when the lawmakers say, hey, listen, we want you to do a thing. We don't know anything about it and we don't know how to do it. You go figure it out. Which gives a board or an agency a lot of power and a lot of flexibility and also a lot of work. Having to come up with the words, define the words, that is a much bigger task. We have fairly exact terms to deal with today, and that's good. So we can skip through that. We are here to fulfill the legislative intent. How do we figure that out? We go by testimony that was said when the bill was passed. Anything that was said in the hallway didn't exist. If it wasn't said in committee, if it wasn't provided in testimony, it didn't happen. And that gets very frustrating for some folks that might be on associations or have been part of a bill's genesis. And they're like, no, that's not what we meant. Well, if it wasn't said in committee and the word's not defined, we got to use the dictionary. Are we all with me? I know this is really fast. This is civics fast. Thankfully, we don't have delegative terms. Oh, yes, Jennifer. Did you have a question?
Oh, I'm sorry if I accidentally raised my hand. No question.
Oh,
Just
okay.
trying to do a thumbs up.
Oh, thank you. Hey, I love those thumbs up. So I love this little slide. Even when it comes to delegative terms, you figure it out. We have to stay within the legislative intent. And the legislature might just say, with this bill, you have to create a dog. It can be a big dog, little dog, fluffy dog, but you can't create a cat. You can't leave a word out. You can't say, well, the words we're going to deal with today are professional methods and procedures. You can't say, well, methods, we really want ethics, or we really want color coding. You can't drop anything, you can't add anything. We have to stay within our designated area. Again, statutes, the law that we have, our bill needs to be our constant guidepost. And this is what we're going to talk about later. And keep this in your mind, and I can bring this up again. As we're discussing the rule, I like to get this in on the front so you can kind of roll it around in your brain pan as we're talking. 2 things we have to do when we file rules. We need to file a fiscal impact statement. And you need to help me tell the board, tell the Secretary of State, tell our leadership whether this rule will have a fiscal impact. Whether the extent of the impact and whether the rule will have a significant adverse impact on small businesses. And if so, do you have any recommendations for cost mitigation? Are small businesses going to be hit with this? Are the people that are going to be the focus of the rule, are they going to incur some sort of cost associated with compliance? We've passed rules in the past for, like, say, delinquency. If you let your license go inactive, you get a late fee. Well, we've had some folks say, well, that's a huge fiscal impact. And we say, well, not if you do things on time. There's a way to avoid it, right? It's not like a penalty. This is, in order to comply with this rule, everyday people following the rule are going to incur some kind of cost. What might that be? And is there a way to get away from it? Okay. And we also have to do a racial equity statement. Because of House Bill 2993, we have to identify how adoption of this rule will affect racial equity in Oregon. And they're defining it as treating people of all races fairly, justly, and without bias. A statement of how the rule will affect racial equity means how the rule will affect the fair, just, and unbiased treatment of people of different races. Okay. And sometimes it can be kind of hard to get your mind around that. And so I wanted to put this out in front of you so you don't look at the rule, have your conversation, and then have to this might integrate it a little more quickly. Okay. So again, I'll bring this up when we're having our conversation. What persons or racial groups are likely to be impacted by the rule? How might the rule impact racial groups? What are any unintended adverse consequences on racial equity? What, if any, positive consequences might the rule have? Sometimes rules have positive fiscal impacts. I mean, we've had some that allowed people to have access to certain billing codes. Well, that's a I mean, you might have to incur a little bit of documentation expense, but it also has a positive impact. It gives you access to compensation. So, I mean, there's positive as well as negative, and you can keep that in mind as well. And if there's going to be no impact or an indeterminate impact on racial equity, we just don't know, then say why, because all of this will be recorded with Secretary of State. Okay, so here's my tired cat. We all okay? We're all on the same page? Doing well. I haven't put anybody to sleep yet. Ah, Liz, New Taylor, and Michelle, everybody's awake. I love that. Okay, so I'm going to stop sharing the screen right now. Okay, and so now we are going to go to, yay, thank you, Dawn. I appreciate that. So I am going to go ahead and pull up the rule that we're going to discuss today. I'm going to share this with you so we can do some live word smithing. Okay, part of what I put in your packet is the bill that created the legislation. So you can look over, and if you want to look at it while I am also looking at it, it's House Bill 2421. I'm going to hopefully assume you guys all got it. The section that this rule addresses, and this was a very big bill. It bootstrapped a lot of behavior analysis regulatory board things into other statutes in terms of conversion treatment, in terms of mandatory reporting. You know, when bills come out, they're rarely perfect. In fact, they're never perfect. And later on, as the bills roll out, you find out, oh, well, these folks work with children. They should be on the list of mandatory reporters if they suspect abuse or neglect. If that's left out, we can't do it. right? So there's a lot of bootstrapping, but the section that we need to look at is section 2. And section 2, the way you read a bill is the bold is new, the italic is coming out. So we're looking at section 2 that says the office, that's us, shall adopt rules to establish guidelines for the professional methods and procedures, there's that term, to be used by behavior analysis interventionists registered under this section. So the intended audience are behavior analysis interventionists, the RBT level professional that are registered with the Health Licensing Office and the Behavior Analysis Regulatory Board. So that's what we're here to do today. Now, what I've included in your packet, along with the draft rule, that if everybody got it, it says, in addition to abiding by the unprofessional conduct requirements in ORS 676-612, I included that so that you can look at it and see the areas that that covers. Interventionists are already bound by that. And ORS 331.020.0075. That is our fabulous catch-all category called unprofessional conduct. As this this office has gone on for decades, and our cases, we have learned that rules are for people who don't follow the rules, and they have interesting ways of finding the loopholes, the cracks. And over time, the office has collected a series of citable actions that individual boards didn't address. So we have this catch-all category, and I included that in your packet too, so that you can see both statutorily what interventionists are bound by and what additional citable behavior is listed in unprofessional conduct, so that when you look at the draft rule I provided, you can see the picture that exists now and what I propose to you today to get us to the intent of professional methods and procedures. Okay. I know the board was interested in maybe looking at the BCBA Code of Ethics. The problem with that is that gets into ethics, and the bill says professional methods and procedures. So what I did for you and the board was to go to our regulatory department and say, what kind of complaints do we get? What are the citable issues that we are getting with our cases that are specific to interventionists? And from that, I came up with a list of 8 things. I like things simple. I like things clear. And again, you're dealing with an entry-level professional. What do we have that's simple, clear, and enforceable? That's the other thing, is it has to be something that we can take action on. It can't be you should do this or you might consider doing that. That's not an actionable item. It's kind of a may and must, and this is must. You must do these things or you could be cited. Okay? So now that I have talked my way clear to 9:30, does everybody kind of understand the stage that I have laid out in front of you? We have somebody in the chat. It's hard to watch all these things at once. Are you not seeing the bill or the draft rule?
Well, you were talking about italics and bold, and I just didn't know if you knew that we could only see this section. That's why.
I get that. I thought I perhaps mistakenly thought that you were following along on paper, but let me go ahead. Oh, great. I'm so glad. Let me go ahead and no, thank you. I mean, I'm here to serve you and you have to let me know what you need. I'm going to roll. Don't look or you'll get sick.
No, I was following along. I just wasn't sure if other people had access and I just didn't know if you thought that's what you were showing. That's all.
Perfect. No, you're amazing. And this is the rattle trap working at my desk instead of the big Luxo boardroom where everything looks like, the Star Trek, the Enterprise. So the House bill that we're discussing, this is what I pointed out. You see, you have the italic is getting knocked out and the bold is being added. You see, you have some conforming amendments here. The section that we're dealing with is the professional methods and procedures right here. This is the rule that we're going to look at today that I kind of put together. And what I'm doing, again, I just kind of put a card together based on the cases, based on what I thought this profession maybe needed that I didn't see addressed in 676, 612, or our unprofessional conduct rule. And from that came up with this. And these were things that I found didn't land in either the unprofessional conduct. It was very specific to this board, very specific to this professional level, and what the cases kept coming up with. So I now turn it over to you as members of the Rules Advisory Committee to ask any questions you have about the staging that I've provided for you, and also the draft rule that is now in front of you that we can live wordsmith. Okay, Jamie, unmute and go crazy.
All right. Well, I just have a maybe a question or something
Mhm.
possibly to add. So this does not thankfully happen at my clinic, but online.
Your voice cut out, Jamie.
Trying to implement bigger plans, but I have questions and nobody has modeled this for me, and I'm working at home and I'm not sure I'm doing it right. So I'm curious for that first one, only performing duties in which they are competent as determined by supervisor, if we wanted to add something saying that, you know, clinics have to provide that that direction to people who might need it or ask for more. I'd be curious from the other BCBAs if that's common or not.
Okay. BCBAs, what say you?
I think, and just thinking about what you said about like what maybe is actionable, what you can actually maybe follow through on. I'm not sure how you might follow through on that. And I'm sorry, there's many hands raised and I just jumped right in.
No, please jump right in. Please. And if you could just let me know when you go to speak, because I might be writing. Just say your last name and keep going. This is an open discussion. I see Nirvana's hand up and we have not been able to hear you yet. I don't know if your mic is having issues.
No, hi.
Hi.
I just turned it off. I just turned it off because it said camera and mic off. So I was like, okay, I'll be polite and turn everything off. But basically,
all right, A+ player. Keep going.
So this morning I spent like about 2 hours. I got up like at 5 before the kids, whatever, just to go over every single point on this bill. And there's a lot of things I didn't like. Because I kind of felt that most of us specialize in certain things, and it really, a lot of the stuff on that bill really played into scope of practice. I know that we have to do whatever they tell us. The bill is already, it's not like we're not making a decision whether the points on the bill are something that happen or not. But I just felt that we need to specify exactly who can work with who and make that just an Oregon rule. For example, like it's very hard for me to believe that. Yeah, go ahead. Maybe I went.
Oh no, I was going to say your microphone was cutting out, so I wasn't 100% sure of everything you said.
Okay, so I had an issue with scope of practice and who can do what. And I know that whatever the BCBA writes into the plan should be thought and applied by the RBT, but you know, we're talking here transgender individuals, we're talking here stuff that it's very sensitive. And a lot of us are not within the scope of practice. So that's one issue that I've had with this whole thing. So I would like to see like some guidelines, who can do what, and in terms of feedback, getting feedback from the parents, getting feedback monthly or whatever, we can put that in the behavior. I know that there is feedback, but specifically to conduct and scope of practice. So just maybe create a feedback inventory that would be mandatory. So that's my suggestion. Specifically for scope of practice. I mean, everybody's quiet, so maybe I'm not on the same page with
I'm
everybody
just trying
else.
to understand, are you talking about adding that to this methods and procedures rule? Because that's the rule we're talking
Yes,
about today. Okay,
yes,
okay.
that's what I'm
So,
talking about.
okay, okay. So everybody else, we got Rachel, we got Jamie.
Yeah, so I think
Jump right
I
in.
hear what they're saying, and I think the idea here is that potentially only the performs duties in which they are competent. I think that's very general, and so maybe what the doctor is saying is like something that's slightly more discriminatory there, like in terms of like narrowing it. Maybe we have something that refers to like have received or completed some type of competency assessment before they're considered to be competent.
Well, that's part of the licensing process. That's part of the registration process is before they can
Right.
perform independent services,
Right.
they have to
Absolutely.
perform a competency assessment.
I think
So,
I was more so referring to like the specific intervention in which they would be like implementing rather than just
oh,
a general competency assessment. Like their competency has been assessed on the particular thing in which they are asked to do. And I think that would speak into like maybe what Jamie was saying too, which is that sometimes people are asked to do things or to implement things. And there's no real way of determining competence or demonstrating competence in that area.
okay. So
Yeah,
what would
exactly.
be some
And
better
to give
words?
you a little insight into it, the competency that test or thing that you are done before you start practicing direct therapy one-on-one as an RBT or a BT, there's a 2-hour period, or at least from what I went through, there's a 2-hour assessment where some the clinical director or one of your BCBAs is watching you do like interact with a client. It's really fast, and it's just not that comprehensive. Like it
Jamie cut out.
really high level.
Okay. What would be, I mean, Lisa, Dawn, Michelle, I mean, what would be some extra words, different words?
Well, I just put this in the comment, but I'm concerned that the RBAI would be held responsible for something that they don't actually control in their environment, and that if this is a concern that the group has, that this would be an a LBA role under, a rule to be
Okay.
addressed for the LBA's role, because they're the ones that are writing the plan, they're the ones who are doing the assessing. The RBAI doesn't get to determine for themselves if they're competent. So I just don't know if it fits under this rule because it's a determination made by somebody above them.
Okay, just for future reference, let's not use the chat because there's no way to capture that for the public meeting. And I just got the high sign from somebody. There's no everything for this meeting has to be captured and available to the public, and there's no way to do that. So if we
Gotcha.
could stop using the chat for 1 second and just say it verbally. And I totally get that. Continue. We have lots of hands up.
Yeah, I'll jump in, and I just popped this in the chat, so I'll read my comment just for the record. One revision I had jotted down when I was reviewing this was putting something in about the scope of practice. And so I think that would hold some of the BAIs accountable to not completely doing something that's way outside of ABA. So we've had BAIs who say, oh, parents suggested this, that sounded great, I went ahead and tried it. And so of course that wasn't the direction of their supervisor, but it's a reminder of them to always practice within their scope, and that should be determined by their supervisor. I definitely echo what Dawn was saying as well, of really the analysis of that competency and how that's done is the role of the BCBA. So the BAI really doesn't have control over that. And I think the hard thing is we want to make this specific enough so it's enforceable, but not so specific that it's not obtainable. And so that was kind of my thought of adding in a blurb about it being within the scope of ABA. So if we have a BAI who used to be an SLP or something like that, that they're not necessarily practicing outside of their scope into another profession, if that makes sense. So that's my 2 cents when it comes to that first point in this procedures.
Well, how I've made some adjustments because again, live wordsmithing rocks. Does this get us here? Only perform duties within their scope of practice and applied behavior analysis in which they are competent as determined by a supervisor. Does that get us there?
Maybe we could
Michelle?
add as determined by a supervisor and the supervisor's competence, area of competence. So it's not just that the supervisor's determined, but the supervisor's actually competent in what they're determining. I think is it kind of what I'm hearing people saying is that maybe it's the supervisor that's not competent and then they're guiding someone to do something that they're not competent in, if that makes sense. It's kind of a circle, but
Okay, no, I get it, but how would we, who gets to decide? And see, competence is another one of those inexact terms, delegative terms.
yeah,
Who
I mean,
determines the competence?
Yeah, I mean, the supervisor is going to be making the determination whether they're competent or not, I think, but that is something that if it were brought to investigation, they would then have to prove that they are competent through training modalities and so forth. So I don't know if we have to be that super specific, but we could say by a supervisor who is competent in this practice, competent in the practice they're guiding.
Well,
or-
the supervisor has to be either a licensed healthcare
Right.
professional, which is determined in statute, or a licensed behavior analyst or a licensed assistant behavior analyst.
Right.
Should
But
we
they
just
may be
list those
guiding
roles
in
and
a-
determined by the lead BCBA, BCABA, or whatever?
Well, I think
are
and I could be wrong what Dawn was saying before, but I think we have to be careful because this is just a rule and this is just about the BAIs. So that in the sense of course, the BCBA should be held to the standard that they are only training in things that they're competent in. But should that go into this methods and procedures? Because this is just, about regulating the BAI, not the BCBA, if that makes sense. I agree with what you guys are saying, but I'm just not sure if it's appropriate in this section of what we're working on.
Yeah, that's fair.
But it does clarify where the competency comes from. So if an RBT says, "Oh, my supervisor told me to do this," and they're competent, that their supervisor has to be tied to a other code of ethics or methods, and so I do like a licensed supervisor to specify and clarify who is making the that determination.
Specify the word supervisor.
But is the BAI held accountable for their supervisor's lack of discretion or competence? And that's where I'm stuck here, is if we're saying these are actionable items for the BAI, can we hold them accountable for not knowing the extent to which their supervisor is competent or not? Their supervisor could lie.
Well, here's the thing. If we get a complaint, and we've had this happen, we get a complaint from about an interventionist. Our investigators, we are statutorily required to investigate all complaints. Our investigators pull records, pull client charts, all that stuff, and say, okay, what happened? What did you do? And then there have to be actively supervised. Ongoing training and supervision is the statutory term by either a licensed healthcare professional in the statute or a licensed BA or ABA, right, through the health licensing office. Then we contact their supervisor and we say, what kind of supervision were you providing? What happened? And they're held by their own ethics. They are held to, through, we have it in rule, the behavior analysis certification board's code of ethics. So there's a whole supervision piece in there, if that makes you feel any better. Michelle and Lisa, you got your hands up?
Yeah, I was just going to say, and correct me if I'm wrong, but I feel like the competency of the supervisor would be caught within their own laws and regulation. Okay, perfect. That's just what I was clarifying. Thank you.
We got Jessica, Michelle, and Lisa.
I think that perhaps maybe some of the confusion that I was interpreting was you know, which type of supervisor, if they have supervisors that are not just clinicians. Is that, maybe that's where I was interpreting, maybe there's some confusion, like it's by their
Oh, perfect.
clinical supervisor or the supervisor who is uh, teaching them and supervising their clinical practice rather than, you know, their operations or admin or their billing and things like that, in case there's multiple levels of supervisors that they
Gotcha.
have.
No, the supervision that we're talking about here, and again, we get back to definitions, and I love you guys that you're tied into that. A supervisor of an RBAI has got to be either a licensed healthcare professional, and defined in statute, it's occupational therapy, professional counselors, medical board. These professions are allowed to have RBAIs working underneath them. So, but we don't oversee those boards, right? So if they're registered with us, they're overseen by that board. We get a complaint, we would work with them, right? But for the most part, the vast majority are supervised by their licensed behavior analysts or licensed assistant behavior analysts under the same board as the RBAI. So that's really what we're talking about here. They have to receive statutory term ongoing training and supervision. So, and our interventionists are linked to a supervisor in our database. So if we get a complaint, we know exactly who was working with them. So does that help maybe clarify some things? Create more questions?
I think for me, like I know which supervisor we're talking about, but you know, just written, maybe it's by their documented supervisor or, um, you know, the registered supervisor if it's registered by the state or just on the BACP site.
So Anne, what you're saying is and I believe this just with the review, but the supervisor is defined. It's not just defined in this section that we're looking at right now. Okay.
No, there is a whole set of, let me pull out my giant 40-pound book of many things. Again, like I said, I'm not running the enterprise today. I'm in a little shuttle. So yes, part of one of the big interesting things about this particular profession is that you have people, you know, that are essentially analyzing the child, coming up with a behavior plan, and these technicians are the hands. They're the ones that are out doing it. So we actually have not just supervision defined, we have direct supervision. We have indirect supervision defined in rule and ongoing supervision and training defined in rule. And ongoing supervision and training means a supervisor is monitoring the service delivery of an interventionist by direct and indirect means. And that is in rule. And then we have direct means the training and observation of an interventionist or declarant, that's a term you don't have to know about, providing client services and at a minimum requires the participation of the supervisor, intervention, or declarant client, remote supervision through health insurance portability and Accountability Act compliant technology, as long as it's synchronous audio and visual and in real time. And then we have interventionist, indirect supervision defined in rule. So all of these things are taken care of within the rule set.
Thank you, Anne. With that clarification, it makes that language very clear as to the supervisor and the role of the supervisor.
I really should have included the entire rule set, and that was just my bad. I'm really sorry. I thought I gave you everything you would need, and I made a mistake. So I apologize. If you want, our full rule sets are available on our website, or I'm happy to find anything you need. I apologize for that oversight. So with that being said, are we okay with one adding an applied behavior analysis in which they're competent as determined by a supervisor? We got Rachel, we got Lisa.
Can we, excuse me, sorry, I just wanted to,
Yes.
Check something with you. Is it okay to just specify like full stop and just say, if you're not comfortable providing services within something, please say no, or you can refuse, like just to make sure that we open that people say no, because in our field, it's very difficult for people to say no because they always make it sound like they're desperate and we're like, okay, I'll take you, I'll take this case, I'll take this case. But it should be okay. We should let people know that it's okay to say no. So I'm not sure if that's something that you would like to add.
Oh, okay. I've never heard that expressed before. I'm trying to get my mind around it. Rachel, can you help?
Yeah, I was actually looking for it. Actually, I did refer to the ethics code from the BACB because it does talk about like so it talks about using like restrictive or punishment-based procedures and like unfamiliar interventions. So that way, like, I think what it's, what Dr. Nirvana was speaking into was that idea that we're not just doing it because the supervisor like told us to do it. We actually are competent and feel that what we are doing is an ethical, procedure with a client. The other thing that I was gonna just kind of follow up on as far as that number one piece is like, rather than it saying as determined by a supervisor, could it say like as confirmed by a supervisor? That
Or
way
as
it's not
agreed
like,
on? Yeah.
yeah. Well, just because like I would think that we wouldn't want it to say like, I told my supervisor I know how to implement this procedure, and they were like, yeah, you were determined to have, received competency here, rather than like, I've actually done my due diligence to make sure this person can perform this correctly.
What do you call it? Is it a procedure? Is it a modality? What do you call it if it's a particular?
Maybe like an intervention.
Yeah, that's what I was going to say right now. But this is good. Tell a supervisor if they're unsure. I like it about performing an intervention and whether you need extra training or, I mean, this is good. Whatever you're writing.
I'm just flowing with you guys.
Is there any way that they can say no because of ethical reasons?
I don't.
Like they don't feel a procedure is something that needs to be done. Like, for example, Q-tip, use of Q-tip on a 6-year-old. I had this case. I had someone use, teach a 6-year-old how to stick something like low level, kid, stick something in their ear. And I was like, no, but that's a personal choice. That's my ethical thing. It doesn't mean that other people would feel uncomfortable about it.
Can we
Could
add
we
it?
put
Is
in-
it only? Oh, sorry. Go ahead.
Could we put in, what I'm thinking of is how to summarize this, this idea of the supervisee should be able to have a say as well. So I wonder if we could simply add in just a couple like words in the sense of only performs duty within the scope of ABA in which they are competent as determined by their BCBA and comfortable independently implementing, or something like that, because then we're giving the BAI a little bit of like the confirmation that they're also feeling comfortable and competent in that, not just the supervisor. So that would be, I wonder if we could incorporate that into what number one already is saying. But I also know that
what I was going to say. Exactly.
it's
I was
10
like, we
o'clock.
can put it right there.
One.
We could put it right there. I do want to kind of like give a nod to the BACB ethics code, but my understanding is that if you are not an RBT, you are not held to that ethics code.
That is correct, and that brings us back to the statutes, which deliberately left out any ethics placed on interventionists. This professional methods and procedures is a new addition. They had no CEs, they had no ethics, they had no methods and procedures before this bill, and the interventionists are not tied to the BCBA in any way. We do not accept the RBT credential, and this is per statute. So the bill that created the board and the licensing strapped the behavior analyst and assistant behavior analyst to the BCBA and deliberately left out the interventionist. So the interventionists have no connection to that association. So that's why this is a new thing.
Yeah, that's why I think it's like everybody, it's just important to kind of put in there that they only perform duties that are within their scope. And I don't know how to tie in ethics, like they feel are ethically appropriate, but what ethics?
Well, and we can't, you can't act on ethics because how do you investigate? if you go into inexact terms, and also this says methods and procedures. This doesn't say ethics. Methods and procedures, I can read you the dictionary definition if we need it, but it's more process, procedures. It has nothing to do with ethics. Jessica?
I like this wording and giving the interventionists more agency in deciding. I do think that it's pinging my sense about thinking about that fiscal statement, though. If someone's like, I'm not confident, then it's putting the burden of supervision on the supervisor and the agency when there's a certain number of billable hours that they can recoup from insurance companies. And while, in theory, it's a great investment, you should supervise as much as you need. I do think that would impact people financially, having that confident word there, since it is inexact, even though I like it.
Jennifer?
This is why, Jessica, I completely agree. I was just thinking about that and you said it so well. Yeah, what if they just keep saying, I'm not confident, I'm not confident, I'm not confident, I'm not confident? Or what if they come back after something and say, well, I wasn't confident? Like, how are we
would
judging
we-
confidence?
Right, and if we had to investigate, how would be if this and cases, remember our cases, if people argue with them and say, no, I don't believe this is true. Number one, how would an investigator investigate and confirm or deny confidence, which is a very delegative term? And if we went all the way to an ALJ, which is a very expensive proposition, and we were trying to hold somebody accountable, and they said, well, I wasn't confident. How is that something that could provide evidence? How is that something that could be proven? Michelle?
Yeah, I think the word confident is dangerous here in the sense of what it could hold, and I'm not sure it gets exactly at what we're trying to capture. So I'm wondering if it could be as confirmed and agreed on by the supervisor, because in the sense of agreed, that means that the supervisee and the supervisor has agreed on the competence. And in our field, what I'm thinking of, which would be an easy way to show this, would be a simple procedural integrity measure, right? Because then the supervisee has been given that feedback that they're performing at that standard. The supervisor has assessed that standard, and it's agreed on by the supervisee and the supervisor. So I wonder if that would be a better term. I also know us BCBAs, we get very fixated on exactly what something says, but I know it's 10 o'clock and we've gotten through number one. So
we haven't gotten through number one.
Yeah, exactly. If this is something where we need to leave it as it is and kind of revisit it, I'm very comfortable with that as well.
I like what you're saying about confirmed and agreed upon, because that puts the BAI, that gives them some responsibility.
If a supervisor confirmed something, how could they confirm? And I'm just playing devil's advocate. How can they confirm something and not agree to it?
That's a good point.
I'm just asking. If they confirmed it, they say, yep, you did this modality. I looked, you're doing it right. How could they confirm it and not agree? Michelle? Oh, Jennifer?
Sorry, I didn't mean to leave my hand up.
No,
I was thinking agreed on by both the supervisor and the BAI, if that makes sense. So like they are in agreement. But at the same time, I think the reality is if the supervisors confirmed their competence, we should be, I don't want to say trusting that supervisor, but that supervisor has their own regulations and ethics that come into play here. And so really, if it is confirmed by the supervisor and the supervisee disagrees, then that would be, I feel like, caught under those laws.
Okay.
So yeah, and now I'll make sure to lower my hand, sorry.
Oh, no, it's okay. And so we're going to leave this one on the table just because folks were really happy with it. And we're going to maybe move forward and then come back to that to see if our feelings change. Does that work for everybody? Lovely. Didn't see any hands. Oh, I got a thumbs up. Thank you, Jamie. Oh, and Jennifer, I love the thumbs up. Okay, so the second one I came up with, because this was something that seemed to come up, was follow behavior plans as directed by a supervisor. You don't go off script. You don't make up your own stuff. You are there to do this. How do people feel about this? Jessica?
I think that there's a lot probably that can be said here just because the context is shifting a lot and there's concern in the fields that, perhaps is just addressed clinically where the behavior plans are not as robust as they need to be, like in considering a scent withdrawal. But, the interventionist there in the moment, if a kid is withdrawing a scent or a client is withdrawing a scent strongly and it gets to the point where harm could be done by complying with a behavior plan when potentially the behavior plan didn't address all contexts. I think there should be some out, for the interventionist or some statement about that. I don't know the statement, but I wanted to posit that concern.
We've got hands. Jennifer?
Yeah, I just wanted to, one thing to consider would be maybe follow treatment and behavior plans. I know sometimes we're really working more on skill acquisition with our learners, and there might not necessarily be like a specific plan in place for decreasing behaviors, but more about, increasing language or something.
What about or? Because if we say treatment and behavior plans, that implies both. It's your world, you live in it. So what if we said follow treatment or behavior plans as directed by a supervisor? Does that get us there, Michelle? Dawn got a thumbs up. I got a clap.
I think you could say and/or because they might both be a part
if we whoop, screech. No, just to let you know, there's things that the DOJ tells us and holds a yardstick over our hands and says don't use and or we will bring this ruler down on your knuckles. Mainly because and or if you're going to court, you're going to the lawyers want to be able to say as clearly as possible, do not do this. If it's this and or that, you create an automatic ambiguity that I think there's an alarm that just went off at the DOJ somewhere that was like, whoop, whoop. No, so we want to do either you can do a treatment or behavior plan, or we could do treatment and behavior plans. But and or, that can't do that. Rachel, Michelle, what do you got?
Yeah, I think my thoughts were along that same line of there's some situations where you're going to have just a treatment plan, and there's some situations where you're going to have a treatment and behavior plan, right? So I think the thought, So I wasn't sure if in that situation, if there's a rule already in place about what a treatment or intervention plan is defined as. Because sometimes, I would view a behavior plan as part of the treatment plan personally, and that would encompass all of those things. But I don't know if there's conflicting thoughts here that we need to be more specific or restrictive, because again, if there is a time where we need to follow through, where we're saying, hey, there's a violation here, we need to be more specific.
No, I think that the treatment, and I just glanced around at all my textbooks. Treatment plan, behavior plan is not specifically defined in rule or statute, that being held under clinical judgment. Lisa?
I was going to ask just that, and also, and maybe this is too nuancy, but a lot of times I think that BTs are given a behavior treatment plan or just some type of written guidance, right, in their data collection module, but then the supervisor comes in and changes something and tells them about it, but then maybe doesn't update the treatment plan for 2 more weeks. So then when they go in there to look at it, it's not, there's nothing concise or something to follow. So I don't know if there's any way to clarify that, like as just maybe I'm thinking more protecting the BT of like it needs to be in writing if they're following it, but I don't know what everybody thinks about that.
Oh, I think we're pondering.
Yeah, I was unfamiliar with this specific discrimination between treatment and behavior plan. But just looking at it broadly as, the intervention plan for both skill acquisition and behavior deceleration, if that's part of the client's program, the interventionist should have protocols that they're trained on that are guided by those documents, because those documents are not updated as frequently, right? Those might be a 6-month document or 3-month, where the protocols might change each week or be updated, even regarding specific, levels of intrusion for prompting and things like that. So maybe it's, they'll follow the intervention protocols guided by, the most recent intervention plan or whatever kind of plan is named in the Oregon rules, or something along those lines.
Yeah, exactly what I was trying. Well, thank you for putting it in better words than I did. I just, it seems like we're guiding all the time, but what is written may not actually be updated until the insurer asks for it to be updated, which is like 6 months, 3 months. Some data collection modalities, depending on the organization, might be updated immediately, but some may not. So I didn't want to leave it ambiguous for the BT to try to, well, this is what was written, but you said this.
Okay. I just want to make sure that we stay within the zone of the RBT. If there was a complaint about, an RBT, and let's just, say for argument's sake, RBT not following a plan. The RBT in the investigation could say, okay, this was what was in the plan, and I was told on this date to do X. Okay, so that goes back to the supervisor. That goes, the onus, if you will, is always on the trainer, the supervisor, the person overseeing the other person. That is where the obligation lies within these statutes. So if they're saying, well, I was following this, but you gave me mixed information, well, then that goes back to the BCBA. Jessica?
I think that the word using the plan here as their rule might be the confusing part, because the plans might be, plans often will include procedures that will start a little bit later if there's a prerequisite skill being taught, for example. And so it's not given to the interventionists typically all together, even the portions that are just for the client. Most plans will incorporate, like caregiver skill development, which the interventionists are not allowed to implement. So the
what would be a better word?
more robust document. I fall to the protocols or interventions that, the session protocols, the current and updated session protocols. And I'm not sure how, each agency or supervisor is giving that to the technicians or to the interventionists, but they are responsible for the interventions that they're trained on and are competent in, right? And so it is sometimes staggered in my experience, where they're implementing things in stages. So it would not be the full behavior plan. If the interventionist was like, well, I saw this on the behavior plan, so I started it, that would be inappropriate potentially. And so somehow specifying a little bit more closely to the present moment, session by session, I think would be good. I don't know the exact word, but
I use protocols, but I don't know. Michelle, you got a better word?
Well, I think the reality is all of us here probably use different words. As Jessica was talking, I was like, oh, interesting. That is what we call it in our clinic versus what some other people might use. I think the key thing that we're overlooking is as directed by a supervisor. So in my opinion, that's the more important part of this, because if the behavior plan, behavior protocol, whatever term we use has been directed by the supervisor to be used, I think that's what's most important. Behavior plan oftentimes is a really big word in our field. So like it's a big
term.
plan.
Okay.
People associate it with insurance reports. So protocol might be more appropriate in the sense that it's more specific, and that's usually what we talk about training BTs on, but oftentimes we'll train BTs on a specific plan as well. I think that as directed by the supervisor is what we're overlooking here, and I think is actually the most important part of that phrase, because the supervisors who should be dictating which plans are in place and which ones have been trained.
Mm-hmm.
I think protocol is a good option only because for the most part in Oregon, we're talking about billing CPT codes related to the, behavior analytics CPT codes, and they say the word protocol. So I think protocol will be more broadly understood and accepted by the profession because we see it in other aspects of, our workflow.
Okay. So Sam? Are you on mute, Sam? I can't
Sorry,
hear
I'm
you.
muted.
There you are.
Okay.
That's okay.
Real quick. I like intervention protocol. Kind of to echo a little bit what Dawn said, as directed by a supervisor. I think there's also a follow-up to this point number 2 is to include some guidance to the RBT to take action to improve their performance following feedback from supervisors. Kind of put the onus on the RBTs to continue to improve their feedback via the direct supervisor.
Mm. I'm adding that as kind of an extra thought. Okay. Take action to improve. Okay, so are we okay with kind of the generic 2? What else have you got, Sam? Oh, he's got his hand up.
That's it. Does number 3 actually? Do we need number 3 if we have number 2? Kind of goes together.
Well, one of the things that, and again, this was just me talking to the regulatory department. One of the things they were saying is there were questions about, one was people not attending scheduled sessions and making up stuff to look like they were. But if you don't feel like that is an important method, like you're out there, this is what you're there to do. If you feel like everybody out there is recording things correctly and this is unnecessary, I'm happy. I'm all for simple. I'm happy to take it out. How do we feel?
I'm not sure that we should take it out.
Yeah, I would say definitely leave it in.
I feel like it needs to be left in as well.
There's
Just
a difference
echoing what everyone else says.
performing it and capturing it.
Yeah, this is White. I agree to leave it. I've personally experienced this, so yeah, I say leave it.
Okay. You got something else, Sam, or is your hand stuck?
I'm all done. Let me just put it down. Yeah, thank you.
Okay. No problem. Okay. So we seem okay with 3. Protect client confidentiality. We like? How do we feel? Got a thumbs up. We got more thumbs up. Oh, we are just rolling. Okay. Because again, that was something that they're not bound by ethics, but this is something that you don't go on Facebook and start complaining about your client. That's inappropriate. And so, okay, so we like 4. 5, report timed, worked with clients accurately. This again, was related to conversations I had about like 3 and 6. Are we okay with this? Do we feel this is something that we need? I got thumbs. I got thumbs. I got thumbs. Yay. Jessica, Dr. Kos?
I think that's great. I think that in my experience in the field, sometimes agencies will say in billing, that's sometimes a different conversation, and they're like, oh, around 10 to 15 minutes, and some people are spot on, like, you report the exact minute by minute that you're there. So I think as long as the agency or supervisor is giving them that information, I think as from the perspective of the interventionist, thinking, remembering those days, like it could be confusing if it's not clear. So as long as it's clear from their supervisor.
Michelle?
Yeah, I have something that I feel like is missing overall, and I'm not sure if it really fit best under this one, and just like reporting accurately and being on time is just a general statement of conducting oneself in a professional manner. I don't know if that is too broad, and maybe goes more under like 8 with dual relationships and things, but just the idea of conducting oneself as professional all the time. I think the concern where this comes from for me is when people are in clients' homes, it's easy to act as a friend or a colleague or a family member, but really needing to remain professional. So I don't know if that's something that would be appropriate to add in here, if that's something more we should add in at the end. But that was one thing, as we're talking about these different things, that the overall, I say it's the professionalism.
And I hear what you're saying. And it's something where, and I see your hand being up, Jamie. The problem with saying conduct yourself professionally at all times, professional is an inexact term. I would define professionalism probably a little different than somebody from our piercing or tattoo board who learned their trade literally out of school and prison. They're going to define professionalism very, very differently. And so in order to eliminate any, and this is just me in the black and white world of regulation, right? Any room for interpretation should be removed. And so what I did was I pulled the word professional apart and I listed it specifically. I didn't say be professional. I said be punctual.
What
right?
if we added, what if we added on number 8, not engage in personal, romantic, or sexual relationships? Because
how would you define personal? How would you define personal?
Oof, yeah, okay.
No, I'm not giving you a hard time.
No,
I'm helping you get down in the weeds with me. Jamie, Rachel, what you got?
I think personal is good because, I mean, how do you define friendship or coffee, or it doesn't have to be romantic or sexual. It can be personal.
Like not related to the work.
Yeah.
Not engage in, okay, let's think of the best word for that. Jessica, Jamie, what do you got?
Concerning one's private life.
Multiple relationship, does that count?
How would you define that?
I mean, dual relationships are defined in our training, right?
What training are you talking about?
I'm thinking of the 40-hour RBT training I did. Like there's a section on dual relationships.
That's the BCBA. That's the BCBA.
Right,
our interventionists don't do that.
Gotcha.
Maybe limit your relationship to the scope of this professional relationship rather than try to define all the other types.
Okay.
And maybe as defined, I'm sure that agencies also have their specific definitions. But in this rule, perhaps your only relationship with this client is that where you're a provider and they're your client.
I like that. And like maybe too, you can say like, have a relationship, a professional relationship, and then say like try to include some examples, like does not include or this relationship should not include romantic relationship, should not include sexual relationship or friendship. I don't know if you wanted to go into that too.
Yeah,
Like
even
doing
babysitting and things like
what it
that.
is and what it is not. If we could do it that way, maybe in the
The
parts.
difficulty with making a list, and I know I'm being, I know I feel like you guys probably feel like I'm pushing back on you, but the problem with making a list, and this has happened, one of our former boards tried to define what is forbidden sexual contact, and they made a list that was fairly inclusive. I mean, hands here, hands there, fingers here, fingers there. They actually tried to do that. And we had the argument, we had a client, and a licensee who was a loophole finder. And he essentially said, well, you didn't include this. And if you're making a list, the assumption is you included everything you wanted, and this is not on that list, so it's okay. I'm just telling you what people do.
Yeah.
So whenever you make a list like that, if you have something that's specific enough to act on and investigate, but not so specific that you said, okay, but you didn't say this, this must be okay, because you would be amazed. Jamie, Jessica, and Lisa, what do you got?
I have yeah, this is Jamie. What if we put something in say about the scope? So the scope of the relationship is limited to the professional services agreed upon and does not extend, or something like that.
Mm. Well, and we have here must.
That like is
Keep.
limited to the professional services agreed upon, or so, because there's like the plans are created and the clients are expecting certain things, and personal relationships outside of that are not, like, those are not a part of the plan. I don't know if this, like, other people should weigh in, but that's kind of where my mind starts to go.
Jamie, Lisa?
I was just going to comment on the word current. Because I mean, someone could be a client today, then you discontinue
Yep.
services, and then is tomorrow okay for sexual relationship?
Well, I actually saw, and I can't remember, because I research rules and laws across the country, and there were some rules that said within 6 months that interventionists could have relationships with their supervisor 6 months after the supervisory relationship was terminated, and they got all into the weeds. 24 hours after the last paycheck. And I was kind of like, do we really want to go there? Do we really want to get, I mean, the thing is you want it to be specific enough to be actionable, but not so specific you put yourself in a box, or start, you can get so granular that it's, I hate to say it, you get down to a pinpoint and then you kind of limit the flexibility of the regulatory function. But do we like this? Limit relationships with clients to the professional settings where services are performed? Is that in addition to 8 or
Well,
instead of 8?
I think it's in addition, because like you could do inappropriate things in a professional setting.
Yep, that is very true.
The things that we should be doing should only be related to the plan, the treatment the interventions that were.
So can we take this out, Jessica?
Yeah, maybe limit their relationship with the client and the client's immediate family, like caregivers or siblings. They can't just go babysit there with the client present, right? So it's really the immediate family to the scope of the ABA service provision for the duration of that relationship as the interventionist being their provider and
Can I
or
throw-
by the rules of their agency.
Can I throw out an example that might be problematic for this? I don't know how many of you are working for for-profits or non-for-profits. It doesn't necessarily matter, but I supervised somebody who worked for a not-for-profit, and one of their family members held fundraiser every year to benefit the entire clinic, not just the family member's child, and staff volunteered at that fundraiser. And so I'm not sure that they could do that under this particular rule.
Doesn't sound like they could.
Right. And I think that's not an uncommon practice. So maybe consider that.
Okay. Jessica, Michelle?
What I was going to specify is instead of the clients and the clients' families, I think the clients and stakeholders might be a better term, because sometimes it's the client's family you're training. Sometimes maybe it's someone who's not related to the clients. Maybe it's a daycare worker, a nanny. So I think the stakeholders might be a better word there.
Good point.
I think we can consider a different word than stakeholders, though.
Would it be caregivers?
Not necessarily caregivers, because it might, I don't know if they would always be, I don't know. Give me a second to think of something.
But I'm
Okay.
also going to consider the professional settings question. I mean, I know a behavior analyst I respect a lot just participated in a fundraiser in a very clearly delineated fashion, but it's a relationship outside of the professional setting.
Yeah, I wonder if settings, I feel like you can maintain a professional relationship in a different setting. So if someone went to like the same church, but they weren't, you know, didn't interact with them, but still nodded and said hello, but didn't disclose anything, like that would be fine. So I think the settings is the word of caution from those examples.
Yeah, and I'll also throw out a rural situation here. You sometimes can't. Like, we have a multiple relationship code in the BACB that says you avoid them when you can, but when you can't, you create boundaries for them, but that you don't not have them. So I definitely have staff who teach Sunday school. They're the only Sunday school teacher at their church, and they're the client in their class. And so our discussion with the family was, they're not your therapist in this moment. They're a Sunday school teacher. And, you know, but if we said they can't do that anymore, then there would be no Sunday school teacher. So
Okay,
I'm worried about the rural impact of something like this, where there's communities are small and there might not be other providers to refer to or other settings in general.
I'm getting it. So are we okay with, if we strike 9, and again, what I tried to get with the general thing is you don't accept gifts, because that seemed to be the bartering seems to be very big in this profession. You don't accept gifts, and you don't engage in romantic or sexual relationship with client. Now, we can take current out if you want and make it forever. With clients means that you're working with them. Supervisors means you're in a supervisory relationship. If we took current out, then that's just full stop and take 9 out. Does that get us there? With the rural settings, limited access, Michelle?
I would not take current out, because I know supervisees and supervisors who have had relationships and they deliberately wait until the supervision period is over or a job is terminated. So they go about it in a very appropriate and professional manner. So that would be my concern if we took out the word current.
Current, okay.
And we could say 2 years, which is, I think, a standard that BCBAs or LBAs would be familiar with, because I think it's 2 years.
Yeah, I stand by my concern with current, that I mean, I have seen people end a professional relationship with a client who was, not a child, but still it was inappropriate to have the relationship the next day.
Right. So if we said you can't do that for at least 2 years.
And just to kind of clarify what I was saying, the relationship with clients that I'm not as worried about, but the relationship with supervisors, supervisees and supervisors are oftentimes very close in age. And so I think that that's setting up some staff to fail of, they have a supervisor, they end up being attracted to them. They leave that company to pursue hours under a different supervisor in order to date that person. So I've seen this happen a few times.
But I mean, they technically can't. Our code says behavior analysts don't engage in romantic or sexual relationships with former clients or stakeholders for a minimum of 2 years from the date the professional relationship has ended. And then I'm looking for the supervisor one. But I mean,
It says that for the supervisor or for the client?
No, that's the client one. I'm scrolling for the supervisor one.
Okay. Yeah, can you
sure
post it?
there
I'll
is
look at the
one.
supervisor too.
Yeah.
I think there is one for the supervisor. I just can't remember what it is.
There we go.
Okay.
It's section 4.
Okay. Okay, so are we striking 9?
I have
Can we live with it? Go ahead, Jessica.
I wonder if the burden for these multiple relationships can just fall on the supervisor, where the interventionist just needs to disclose any potential multiple relationships, and that way their supervisor can help them delineate, oh, well, we're in a community that's limited. Only 5 people speak this language in our community. So yeah, you're going to run into each other or whatever. Let their supervisor help them figure that out.
It's going to be very hard to get the board to drop this because we actually had a case that ended up in criminal court.
Yes,
with something
we
like
did.
this. So
I think the sexual relationships totally makes sense, but just for any multiple relationships otherwise.
She was talking about number 9.
Yeah, to replace number 9 with BAIs have to disclose multiple relationships. And then they and the not stakeholders, because we don't like that word, but they and the behavior analyst and the interested party figure out the right solution.
Yeah, I love that.
So I did revisit our ethics code, and for the supervisor, it just says they don't engage until all parties can document that the professional relationship has ended, which is what I have seen in the field happen, of that all of a sudden needs to be terminated.
Okay, just again, be careful with the ethics. This is professional methods and procedures. Just be careful.
Right.
We were just talking about timeline. Yeah.
Yeah, I'm saying I'm comfortable with 8 being not engage in romantic or sexual relationships with clients for 2 years after. I think, or supervisors, that is really going to set people up to fail, because if they get out of that professional relationship, I think that's the most ethical thing to do, versus obviously with clients, that's completely different.
But you still want the 2 years in there, right?
With the sexual relationship for clients, I'm comfortable with that, but I wouldn't be comfortable with the supervisor and supervisee.
Okay, so are we okay with this?
Why don't we add another number that's kind of copy and paste number 8, but then change clients to supervisors and change the timeline
to current?
Yeah, that works.
And maybe include that language that, like, it's been documented that in some way that the relationship has ended. So then that way you're covering yourself in that moment, where I think one of our other colleagues had mentioned that.
Okay, so am I keeping up? Supervisors for 2 years after the professional relationship.
Replace 2 years with that language.
Oh, and current.
I think, yeah.
With current supervisors until the supervisory relationship has been documented to be ended, but nicer words.
Does that get us there? Okay, Jamie's okay with that. So are we still okay? So as we kind of jumped over, report time, work with clients accurately, because that was something that showed up again and again in investigations. Be punctual.
Yep.
We had a lot of folks who were like, yeah, you were supposed to be somewhere. You said you weren't, and you weren't, or you showed up half an hour late and billed for the whole hour and not accept gifts. Are we okay with that? Jessica, Rachel, we're all talking.
Yeah, I think that reporting the time work with clients accurately, I think that's great. Being punctual, I don't know if there's room to leave, like, unless you have like a reasonable accommodation. I'm also an ADHDer, and so in like my handbook, I have, there's an accommodation for time blindness where, there's some wiggle room or you communicate it. But I'm just thinking I'm perpetually late. I'd be cited by this very frequently. So maybe, I'm just thinking what punctual is to this rule versus your agency and any agreements you have with your supervisor as the interventionist, say, for example, an accommodation.
My hands all over the place.
What about people that take like public transit? So I agree with punctuality, but I do think punctuality is a somewhat, I don't know, it's a lovely life if you can manage to always be punctual, but it feels a little limiting. I don't know how to really
I agree
word
with
it.
Lisa. I agree with Lisa. That was actually my thought as well, is like, I think that's one of those like financial kind of, and like also like limiting like diversity wise, like there are people that take public transit, there are people that rely on other modes or methods of transport, and I have known, like, if that's the situation, we've made agreements or like arrangements with families to just know that that's a possibility.
Okay, well, if you've made arrangements, and here's the thing, is this a complaint? Think about it not from the all possibilities, but from the complaint standpoint. If we get a complaint on an interventionist and they said they were supposed to be, and this was something that was brought up by the board. Okay, yeah, you have somebody, they're supposed to be there at 10 o'clock on certain days, time after time after time. Oh, I forgot, or there was something else. It was just kind of something under that professionalism thing that kept as an issue showing up. But if you've got an accommodation, I mean, think about who would complain. What would have to happen in order for a complaint to come in and us to act on that? And is that outside the world of accommodation, or the bus was late, or it's would a reasonable person complain that you were late if the bus got stuck because of a train? Michelle, Lisa, Jennifer?
Mine's actually about a different point, so I'll wait till this conversation
okay.
wraps up.
Yeah, because we gotta get on to our racial equity statement and our fiscal. Anybody? Are we okay with it? Do we want to take it out? Want me to draw a line through it? What do you want me to do?
Do we need it? I mean, if we need it, then I guess we leave it. But I just
no. I mean, if you guys don't think we need it, I will draw a line through it and tell the board that you didn't think that was necessary.
I don't necessarily. I think I see it more being limiting than being helpful. Yeah.
Okay.
Personally.
Well, you added things and you took things out, and that's your job. So we can do that. Any final thoughts on this before we go on to fiscal, Rachel?
I just had one other thing to say about number 8, just like some clarity there. I think where it says until the supervision ends and is documented, I think it needs to say where the termination or the end of supervision is documented, just to be a little bit more clear about what needs to be documented. Because I feel like the way that
supervision ends and
the end is the termination exactly is ended. I just think that, yeah, perfect.
Okay. Michelle, any last thoughts before we go into fiscal?
Yeah, so the one that I had thoughts on was the report's time worked with clients. I think one of the things that a lot of our BAIs don't know is actually that they're responsible for filling out their interventionist supervision log as provided by the licensing board. And so I would love to have just a statement in there about that, because I think a lot of people don't even know it's something they should be filling out.
Well, that would be on the supervisor, because I mean, that's in the law that they have to, they have to do that.
As outlined in the rule, the registered interventionist actually has to maintain the law.
Yeah,
Or it has
the
to
log.
maintain the log is what I meant to say. Yeah.
Mm-hmm. And so the rule that already has that they have to be doing that.
Oh, gotcha.
Why-
So you're saying it shouldn't be written here since it's documented
Well,
elsewhere.
well, no, I'm just, okay. Because they have to fill that out. I mean, that's requirements. I'm going through my giant book here again. Okay. Yes. A registered behavior analysis interventionist must maintain all training and supervision records for a minimum of 5 years after the last day of training and supervision and must make records available for inspection by the office. That's 824-040-0010.
Okay, perfect. Then no need to include it here. Just wanted to make sure that
It is covered. Good for
Yeah.
you. Okay, any last thoughts, Michelle?
Quick
Okay.
question for the group. This might just be a not a point, but on professionalism and as we take out being punctual, do we want to add something about communication, communicating? Because, as you're bringing up, there are a lot of reasons why someone might be late that are acceptable, but not communicating well is not professional. I don't know if there's a good way to define that, but just a thought.
Could you say be punctual to schedule sessions or communicate difficulties, or you know what I'm saying?
Yeah, I mean, BCBAs, do you think that that is necessary? Or I'm just kind of thinking of something that I'm always seeing in our chat, which is every day there's some, people are really communicative about like, shoot, I got stuck in this thing. Can someone make sure that my client is okay for those first 5 minutes or whatever? Like, that's really helpful. I don't know.
I don't disagree. I just think that, or I also think that, some of the guidelines would come from the agency or, their
Yeah. Okay.
agreement with their supervisor itself. And so I'm not sure how much of the rule needs to say follow the rules of your agency or your guidelines that you agreed to. Because I think, communicating that it's like be punctual or follow whatever the rules you've set out, that, is your specific situation.
Yeah, awesome. Okay, cool. Thank you.
So we got that. Fantastic. So I know I'm shoving us along here, and if we have the luxury of going over a couple of minutes, great. If not, we have to do the fiscal and the racial in 20 minutes. So here again is the fiscal. Is the rule that we are sending to the board, will it have a fiscal impact, good or bad? What is the extent of that impact? And will the rule have a significant adverse impact on like practices, small businesses? How can we fix it? So what do you think? Do you think that the rule that we just came up with, and if you want, I can go ahead and leave this up. Now, if you can think about that, or if you want to look at this and think of those things, what do you think? Is there going to be a fiscal impact of this rule on okay, we can start with interventionists. Are interventionists going to have to incur any costs, extra education, documentation, office supplies, computers, staff to keep track of their work? Is anything here going to make the interventionist have to spend any money? And if so, what is it and how much?
It looks like we're saying they have to gather and report data accurately. So that would imply that if the company doesn't give them a way to do that, that they would have to spend money to do that.
Is that a common practice that they would tell them to do something and not give them the supplies to do it?
No.
I don't think so. I don't think it would be, but I don't know everybody, but I don't think so.
I personally don't have any, I don't see anything here that would have a huge impact financially on BAIs.
Me neither.
Okay. That's an impact. And that was the other thing that I was thinking of. It's like, okay, what can, and you know, sometimes if we have like a late fee or something like that, it will only affect you if you go late, you know, so there is ways to get out of the cost. So if they are doing their job properly, nothing here would have a huge impact money-wise. Okay, what about the supervisors, whether this be a licensed licensed behavior analyst, assistant behavior analyst, or another licensed healthcare as represented in the statute? Like anyone running interventionists, will this cost them any money?
I'm sorry, are you talking about this as in the whole methods and procedures? What we started
This
talking
rule,
from the
this rule.
start, or just this one rule? Okay.
This one rule, if we put this into effect, will this have a fiscal impact? We talked about interventionists and they looked it over and they said, no, there's nothing here that will really cost them anything. Would this run up any expenses, this one rule, for anyone supervising them, a BCBA, another licensed healthcare professional? This rule.
No, because
Not
these
that
are
I
already encompassed in other rules that we've already decided don't provide a huge fiscal impact.
Yeah, I agree.
This is White, I agree.
Okay.
These look all within my day-to-day supervision responsibilities. Yes.
Perfect. Oh, I love the floating thumbs. Okay. What about
if we
small-
needed extra training in something? What if they needed additional training in any of the points?
Well,
Okay,
I
so
think
that-
that
Take a little
one.
bit of time.
Right, but I think that's already in our scope of practice. I wouldn't see any additional financial burden from this. Like that's already in the code of ethics that I have to follow. I don't see this adding any additional impact to me as a BCBA.
Aren't we supposed to talk about the code of she keeps on saying we're not talking about code of ethics, we're talking about methods and procedures. So if at one point any programs take additional training, shouldn't that incur some cost?
Can you
So
give an
if-
I'm just saying.
example?
So if an
Wouldn't that
interventionist requests more training, is that what you're saying? If they need more help with something,
Yes.
would that incur a cost to the company that employs them or their supervisor?
Both. I need to know too. And the company needs to be up to date. Or
Okay.
connected. I'm just saying, I'm just playing devil's advocate.
No, that's fine. And so if they have additional training, if an interventionist requests additional training, would that incur a cost? Literally all of them would, right? Because it would be every supervisor would have to adjust that cost. Every company, is that accurate? Do we know how much that would be, or would that be an indeterminate amount? Is that a true statement?
I feel like professional growth development in the areas in which you're going to practice is already an expected cost. I don't know that it falls as an additional cost because of this rule. I think it is a cost, but I think it's one we've already agreed to do by our profession.
I would agree with Lisa.
I
No
wouldn't
additional
assume.
cost by how this is written out.
Yeah, I wouldn't really just assume that it's added. It's just making it like, oh, we're assuming that they're going to do it, or the company's assuming that we're going to do the training. I'm just saying.
I think that it falls under number one of how a company would interpret and want to document that confirmation. I think some agencies that I've worked with and colleagues, they'd want to have a special piece of paper for each protocol or each competency, and then spend the time reviewing that with the interventionist and making sure, and then having a release sign. And it would be a big deal for them to make sure they're documenting it. But because there's no specific piece of paper or way we're saying in the rule, or that the rule is saying it has to be documented for that confirmation, I think that there's also the potential that it falls under the existing practices for training interventionists as well.
Okay. So I could put in the impact if companies or supervisors have not already allowed for additional training, that having them ask for it might incur, and we could say may incur a cost, and that cost is indeterminate. Does that get us there?
Yeah. Oh, I like that.
That sounds good.
I've been doing this for a while. Okay. Okay. No, this is great. This is a great conversation. Thank you, Jamie. And that's the thing about this rule is, again, we try not to, create whole new wheels that people have to then adapt with. Okay, are there any other impacts? I mean, we've covered the small business. We've covered obviously if the person requests additional training and that is not something that is already absorbed in current fiscal business plans, that would be an additional cost, but the cost is indeterminate. We don't really know. And that's the other thing they ask is how many small businesses would be affected. I would think that would be indeterminate unless you guys have more information than I have. We don't know how many small businesses might fit into that example, correct?
Correct.
Okay, that's all right. Because I mean, that's kind of how I figured this was going to go. Because there's nothing here that's like go out and get a master's degree, right? That would be an extreme example of fiscal impact, right? You have to go to school, pay for school, you can't work. Those are the things when they come along that are big tickets. Okay, so, and this is the exciting part. Can you tell me in this rule what persons or racial groups would be impacted by this draft rule? Anybody? I mean, when you think about the communities,
Impacted
priority
negatively?
or in any way, helped, hurt. I mean, will this rule shift the needle on racial equity? Looking at the underserved populations, and again, we have rules that are affecting school funding. We have rules that are affecting, access to healthcare. This 2993, it might be indeterminate. We might not know. But this is something we have to put in front of our racks because this is a priority for Oregon, is closing those gaps of institutionally underserved populations and communities that haven't had the same access to care. So we have to ask the question, and it doesn't always fit sometimes. But is there anything in this rule about interventionists, methods, and procedures that you think might impact a particular racial group? Any adverse consequences to racial equity? Would it make it worse in some way that some communities don't have the same access to things? Are there any positive consequences? Are there any other resources you could recommend where I could look this up? Because I would have started on it, but I didn't know where to look. So, and if there's going to be no impact or indeterminate impact, tell me why. We don't really know. We say we don't really know the racial breakdown of interventionists. We don't really have a strong grasp on the clients they serve, or maybe clients get served equally. Do communities of color have access to interventions and this kind of service the same? I mean,
Anne, would you pan back to the rules again?
yes, absolutely. I'm here for you.
Just thank you.
Of
So we can
course.
keep reviewing it.
Sam?
And I just, when we strengthen these professional methods and procedures for our interventionists, it's going to have positive impact to all the communities who are accessing services, specifically those with like language barriers or second English is not their first language specifically. And so if there's any kind of unknowledgeable information, this just from one family, one stakeholder to the interventions that they're receiving, this strengthens the protection of these stakeholders and people and families.
Okay, so you're saying that bringing the methods and procedures to this level of professionals is going to improve a positive impact on all the communities, especially communities where maybe English is not their first language, and it would strengthen service provision. Am I understanding you correctly?
Yeah.
Okay. That's wonderful. Thank you. So folks see this as positive, better service provision across the board. You don't now, do you see any negative impact that these rules, if adopted, would move the needle in the wrong direction? Because I mean, this, because we live in the world of unintended consequences, right? And sometimes great ideas go downstream and have negative implications. I mean, we've had some boards that have risen the stakes so high, have risen the quality standards so high that now nobody's qualifying for licensure and now they have a shortage of providers. So that's an unintended consequence, right? So whether it's racial, financial, whoop, are you there? Do we have any other thoughts? And believe me, if you leave and you go, wait a minute, I have some of my greatest thoughts when I'm washing my hands in the bathroom. You think of something, please tell me. And we also have this rule will go out for public comment, and you are more than welcome to ruminate on the work that you've done and send in public comment if you can think of anything, because I don't know what the board's going to do when they see this. They might add something, they might take something out, but there are many more steps and opportunities for inclusion and feedback before this becomes permanent. Jessica, what do you think?
I feel overall like it's fairly neutral for the racial equity statement. I think
Okay.
it, improving practices is good. Obviously, I think that's a positive direction. I think that one way overall as a field to really improve that would be having, required training specific to the populations you're working with. So, neuro minorities or racial minorities and things like that. And I think that is a direction that potentially could be excellent to go in.
Okay.
I don't know that it's in the scope of this one specific rule, but I do think that's potentially a future direction to improve that racial equity.
Okay,
and
so quality
inclusivity.
services will improve outcomes across the board. Am I understanding you right?
Yes.
Okay. And Jennifer?
Yeah, the only like negative thing that I can think of is with number 7, not accepting gifts from clients, and just the cultural implications of that with some groups, and how that might be damaging to the relationship. So that's really the only thing I could think of.
I do
Okay.
agree with that. I agree, but I also think, how you define a gift does help with that interpretation. But yeah, I think that there are definitely cultural groups who do not understand that particular requirement and sometimes get hurt.
Okay, so 2 things. Number 1, do we want to keep it? Do we want to keep do not accept gifts?
We
Yeah.
could put a monetary value on that, as I know some other regulatory things have. And so I know like under $10 is common, or we can just completely get rid of that. But I do agree, Jenny, that could have a cultural impact.
Cultural insensitivity. Okay, Jessica, Michelle, do we want to strike it on the interest of cultural possibly damaging a relationship? Rachel?
I don't know that we necessarily strike it. I do think it's valuable, but I think one of the language terms that I've seen adopted, and like I know Lisa's familiar with this too, is that nominal value kind of language, where it leaves it open because, again, thinking about the fact that this rule is going to be, essentially permanent
actionable.
until,
Yes, it's
and
actionable.
it's going to be a long-term thing. What, maybe specified as $10 now might,
I was going to say
have a
nominal.
change
Let's
in the
stay away
future.
from nominal, because what what the Prince of Egypt thinks is nominal is going to be very different from
Sure,
what
sure.
somebody in Medford is going to think is nominal. So
Sure.
If we're gonna keep this, do we worth more than $10?
I think 10 is a good number.
Yeah.
Okay, because
I
that's
do
an
too.
incredibly important cultural bit of
Yeah.
information.
Yeah,
Right.
wouldn't
I wanna
that
be able
go
to
a little bit
confirm
against
it.
the boards, our
Yes.
professional standards as BCBAs, and then we're putting here, it's okay, but the board says it's
No,
not
it's
okay?
no, the
The
board
board
says it's
says
okay.
10. Yeah, the board says 10.
Okay. I guess.
Are you talking about the BCBA or are you talking about the BARB?
BCBA.
No, the
Okay,
BCBA.
Okay, so if we keep that, that would have a positive impact on some cultures if you are, so you don't offend them and affect that. Oh, that's a great piece of information. Okay,
Thanks,
so we changed.
Jenny. I was sitting on that one, so I'm glad you brought it up.
Don't sit on it, speak. This is important. No, that's really, really important. Thank you, Jennifer. Okay, so we are officially out of time. Do we all feel okay about what we did today and what we talked about? Because I'm really impressed with you guys. I might make you my standing committee. Okay, I'm kidding. I can't do that, but you're doing fantastic. Anything else? Oh, yes, Michelle.
Sorry, I was going for the thumbs up.
Oh, that's
Not
okay.
raising it.
But if we're all okay, our next steps, again, I'm going to clean this up. Thank you. I love the thumbs up. I'm going to clean this up. I'm going to take this. I can't give you a rule schedule, like when things are going to happen going forward, because the board's last meeting of the year is technically in July. If we want to carry this forward, they will need to add additional meetings that will then fall in with the public comment period and reviewing the public comments and then acting permanently. That probably would need to be added in the fall. And as I can't tell them when to show up, I don't know when they will show up. So I will need to work that out at the July meeting. Please, if you would like to dial in and listen to the conversation as a guest, there'll be a public comment period. You can't speak as a RAC member, but if you just like to listen to the tenor of the conversation, participate, we would love for you to do so because you're truly an engaged, fabulous group. So if you don't have any more questions, I can free you into the wild.
Thank you.
We all
Thank
good?
you so much.
Thank you
Thanks,
all
Erin.
Thank
so
you.
very
Thank
much.
you.
Thank you,
Bye.
thank you, thank you.
Mhm.
Have a good
Okay,
day.
everybody, bye-bye.
Bye.